Of some hearing impairment for the last few weeks. The condition is getting worse. Do the relevant examination of the atrial nerve. Discuss your finding and diagnosis with your examiner. Hello, Mr. Michael. How are you doing today? My name is Dr. Ohan, one of the doctors in this department, and I'm here to examine your ears to find out the cause of the problem of your hearing. During the examination, I'll be coming close to you, touching your ears, going behind you as well, until as gentle as possible, and during the examination I'll be talking with my examiner. Is that fine with you? Okay, could you tell me which ear do you have the problem with? Right. Now, if the question says that, the patient said, I don't know, you have to examine both ears, okay? So, ideally I would like to start the examination of the normal side first, but for time constraint, I will examine the affected side. Okay, by inspection there is no any discharge, redness, any swelling. Do you have any soreness anywhere? No. Okay, I'm just touching your ear now. There's no localizing temperature. I'm just going to press over this piece of ear. Tragus test is negative. Ideally, I would like to go for otoscopical examination. So, if the tragus test is positive, which means tender, that means there is inflammation, you cannot go for otoscopical examination. Then, I'm just going to rub my fingers behind your ears. Okay, can you tell me where do you hear better? Left side. So this is just a rough examination. Just do the finger rubbing. Then ask for a tuning fork. Unfortunately, I don't know where is our tuning fork. All of a sudden disappears. So let's assume this is a tuning fork. What's the frequency you have to use?
256.
256 or 512. So 512 or 256. Make sure when you take the tuning fork, you just make sure read the frequency there. Make sure it's either 256 or 512. Okay. So this is a tuning fork, and this is a buzzing instrument. I'm just going to put it behind your ear and in front of your ear. You will feel it like this. Okay. So the ways to strike the tuning fork, you can do it like that. You can do like that. You can do like that. Okay, so it's up to you. So make sure it's vibrating when you put it. You hold it from lower end. Okay, you don't have to touch the bars, and then you start putting it behind the ear on the mastoid, and then in front of the ear. Can you tell me where do you hear better? On the back. So, rhinitis is negative on the right side. You do it on the left as well. Make sure you are putting it on the mastoid. Where do you hear better? So, rhinitis is positive on the left. So, you hold it like that. You put it on the bone. You put it in front of the ear. Ask the patient where do you hear better. This is actually called modified rhinitis. It's not the actual rhinitis. It's modified rhinitis. Okay, so rhinitis is negative on the right, positive on the left. Now I'm just going to put this position on your forehead. You tell me where do you hear better? Right. So Weber lateralized to the right, which means mostly the patient has conductive left. Clear? That's clear. Okay. Right side. Now, after yes.
If the patient admits to the tuning fork behind the ear, he said that I can listen more comfortably behind. It means that the distance is positive. Negative.
Conduction, it means bone conduction better than air conduction.
It's better than the bone in front of the ear.
Which right, the left.
Then it is positive.
Air conduction better than bone conduction.
Normally air conduction is better.
Normally air conduction is better. So
if he hears on the bone, that means this side.
Bone conduction better than air conduction means linear negative. Mostly conductive better.
And when you put in front, And he said that I can listen more better than in the left side.
That means sensory neural difference on the right side.
Sensory neural.
On the right side.
So his right side was affected.
Right side is affected.
Yeah. So now when Weber running,
Yes.
no Weber,
Yes.
Weber lateralized to the same side.
To the affected
Affected
side.
side.
If it is lateralized to the opposite side, that's the sensory neural of the affected side.
So in first test you will find affected or not affected.
Which one?
In Rennie's,
Yes.
you will find affected or not affected only.
Yes. Now you can ask the patient which ear do you have the problem in.
The patient is not cooperating.
Right. He said the right one. So you know the right down is the affected.
Yeah.
Yes. You was
Regarding unit test and group test, if you want to pass lab 2, when you do unit test, whenever the simulator says only back, so it's condition deafness on that side, that, for example, I said I hear better on the back, so it's conduction deafness. Whatever Uber test will be, it's conductive deafness.
Okay.
Whether he hears here, or he hears in Pakistan, it's still conductive deafness. Okay? But if he says I heard on unit test, on the front, both of them, on both sides, he or she hears it on the front. When you do Whipper test, he says, the simulator says, I hear it on the left side, so directly
Opposite side.
you hear something.
Alright, it means if it is here on the back side,
Conductive
then
deafness.
conductive.
Whatever is Whipper test.
And when we did the Weber test here.
Yeah, that's what I was
if
like
the
trying to
patient-
make it easy, you know. Yeah.
One more thing. If it is, he listened negative here, Renner says it's negative here, and put the Weber's here, put the uniform here, then the Weber's test, what he said, if there is a conductive deafness.
There is no
what
conductive
he-
Mention on the right.
Right.
Yeah,
This
yeah, lateralized to the affected side.
which the Renner says is negative.
Lateralized to the affected side, conductive.